When COVID-19 arrived, it didn't create inequities. It revealed them. From housing instability and immigration fear to low-wage work and poor access to healthcare, the pandemic exposed the cracks in our systems. Cracks that too many communities were already falling through. But it also revealed something powerful: the resourcefulness of communities and the critical role of community health workers. In Northeast Colorado, immigrant and refugee communities faced enormous challenges. Many residents worked essential jobs, like at the local meatpacking plant. Social distancing wasn't possible. Information came late or not at all, and often in English only.
Undocumented families weren't eligible for the relief funding. The information wasn't in their language. People were relying on word of mouth.
Overcrowded trailers housed multiple families. If one person got sick, everyone was at risk.
They were saying quarantine, but how can you when 3 families live in the same space?
Community health workers provided translated health information, distributed personal protective equipment like masks, and helped organize vaccine clinics directly at workplaces. They made sure essential workers got care during work hours, and that the information came from trusted messengers.
We were trying to make sure everyone was getting the information in their language with faces they recognized.
They didn't just share information, they reduced fear, they built trust, they opened access to services many were once too afraid to seek.
People started to come to us for help because now there was language support.
And the community showed its strength too. Families shared food, masks, and emotional support. Neighbors checked in on each other.
There was so much connection. Everyone was together in this.
In Prince George's County, the fear was different. Not just of illness, but of being targeted. People avoided testing sites, not because they didn't care, but because they were afraid of what else might happen there.
Everybody's a little reluctant to go where there are tents, especially if you don't have your paper.
Many residents lost jobs. They lived in crowded homes where one infection meant everyone got sick. Community health workers responded with action. They translated materials, helped people fill out clinic forms, and distributed PPE and food without requiring anyone to show ID. They met people where they were: bus stops, laundromats, and supermarkets.
We were out on the streets every day, going to the places where our community gathered, delivering information and resources.
They taught people how to advocate for themselves, with doctors, with landlords, with systems that weren't built for them. And the community adapted. Residents used WhatsApp to stay informed and connected. They found ways to survive. Some even started selling handmade masks.
These are strength. Learning to survive in new ways.
In Alameda County, COVID collided with a housing crisis that had already displaced families. Many people were living in cars, garages, or doubling up in homes that were too small. When the virus came, it hit hard.
People were dying, and we knew who it would hit: those in crowded housing who still had to go to work.
Deep mistrust in the healthcare system, especially among Black communities, made things worse.
People were saying, "Don't come to my community with that vaccine. I am not your guinea pig."
But community health workers built bridges. They used motivational interviewing to understand people's fears and respond without judgment. They partnered with trusted groups like the Black Firefighters Association to deliver health information and run pop-up vaccine clinics in familiar, safe locations. They supported the Mam-speaking Guatemalan community with culturally tailored outreach and connected families to education, housing, and health services.
If you meet people where they're at, if you help them find resources and provide emotional support, you're going to have positive health outcomes.
The community didn't give up. Families grew closer. People shared resources. They found ways to stay connected and support each other.
At first, fear made people turn inward, but then the community came together and unified.
The community doubled down on each other.
Across all 3 sites, the same truth emerged. When institutional barriers increased risk, community health workers responded. They built community capacity. They connected people to and coordinated care, translated critical information, supported families, and helped entire communities navigate an overwhelming crisis. But their work didn't end when the emergency did. To prepare for the next public health crisis, and to address the ongoing challenges these communities face, we must continue investing in community health workers. Because building community capacity isn't a one-time response. It's the foundation of a stronger, more equitable public health system.